We put in an application with a national company that does both national and international evaluations of programs, and they determined our program was qualified, and that allowed all of our physicians who perform various types of procedures to be part of the Specialty Center of Excellence.
What kinds of things do you have to do to make that? Is it quality? Is it patient experience? Is it experience with the surgeons?
It's a combination of patient quality, the experience of the surgeons, as well as the experience of the institution itself, and the patient outcomes database that has to be turned into the organization to allow you to be verified.
What does that mean for a patient coming to a place for surgery that has the Center of Excellence?
For a patient, it means that you have the ability to feel comfortable, that the physicians that are working on you and all the nurses and ancillary staff at a given facility are all appropriately trained and have been have appropriate experience to take care of patients with various conditions depending on the type of Center of Excellence.
What types of robotic surgeries do you do?
The majority of the robotic surgeries we do are hernia surgeries, incisional and ventral hernia surgeries, diaphragm hernia surgeries, as well as groin hernia surgeries.
Robotically again?
Yeah, so we do a lot of hernias robotically, both inguinal hernias as well as ventral and incisional hernias, including diaphragm hernias as well, period. Sorry.
What's the difference between the recovery time? What's different for patients robotically versus open for the kinds of surgeries you do?
We also do gallbladders on patients robotically as well. The difference in recovery a lot of times with patients is that they can get back to work a little bit faster. Smaller incisions can be made with depending on the procedure they're having performed, and that a lot of times allows less post-operative pain, which allows them to get back to activities and including work faster. So not all patients are candidates for robotic surgery. It a lot of times depends on what type of pathology they have. Sometimes the hernia is better addressed open to give them a better overall repair, and even though it might lead to a little bit longer recovery time with that specific condition, sometimes it may be necessary to do an open procedure on those patients. So everybody thinks that when you hear about robotic surgery that it's something fancy like you would see on Star Trek, but it's really a very interesting platform where the robot itself just manipulates the instruments. We use our hands and fingers to basically tell it where to go, and it doesn't squeeze if you don't squeeze it, it doesn't move if you don't move it. So we're essentially controlling the thing at every step. What it does is it allows better movement for your hands because the robot arms are computerized, and so they won't collide with each other or cross with each other, where if you're doing something straight laparoscopically, you might come into problems where you can't reach across or reach over to something to get to where you need it to be. And so it benefits us in that aspect, and obviously then benefiting the patient.
And then the surgeon is not even at the table often.
Correct. The surgeon starts the procedure at the table. We get in essentially with the trocars just like you would in a regular laparoscopic case. And once you're in and you evaluate the pathology and feel that you can safely proceed robotically, then the surgeon goes over to the console where you sit down, and that's where you manipulate the instruments from. The robot has 3D visualization, which allows you to see things a little bit better than you otherwise could laparoscopically. And that 3D visualization helps from a dissection standpoint. It also helps you when you're evaluating areas like potentially intestines, where you're having to look at them to try to decide where you want to make an incision or where you want to cut. And because you can get a better visualization with the 3D, it allows you to potentially make less mistakes. I think the big difference of having a robotic center of excellence from a patient aspect is that they can feel comfortable with the decisions that they're making, already understanding that that facility has a good quality reputation, it has good physicians practicing there, and that all of those things are evaluated on an ongoing basis to keep up those accreditations. And so I think it's from a safety aspect can help patients make a decision.
I'm going to ask you one more thing. Is it safe to have elective care now in a hospital that's caring for COVID patients?
Yes, I think it's safe now to have elective procedures. Our patients come in through a separate area of outpatient surgery, go into the operating rooms. COVID patients typically don't need to go to an operating room. It's very rare. What we will see is that a patient will be complaining of a bulge that they notice and they talk to their primary care doctor about it, or it might be one that their primary care doctor finds on a physical examination. You can also have pain in various areas, usually associated with a hernia, but you do not have to have pain. As a matter of fact, as the hernia gets bigger, sometimes the pain gets less, but then you will notice a bulge. And those are the two most common reasons that patients will come in complaining of those symptoms, and then we end up diagnosing a hernia.
How fast can somebody get back to normal life after a hernia procedure?
Your average patient after hernia surgery, my personal protocol is to get somebody back to doing family walks on day 4, doing a light elliptical or treadmill at day 7, and then at 2 weeks we actually lift all restrictions from the patient. Up until that point, we tell them not to lift greater than 10 pounds for about 2 weeks, just to allow that area to heal and allow their body to recover in general.